Right on.
All right. Well, welcome to our call today, everyone. We are honoring our military service members today. My name is Shannon Roebuck, and I am founder and executive director of Bridging Impact. And my co-host is Ariel Zhang, and she is a newly VP of National Programs at Humane Rescue Alliance. Congratulations for that, Ariel. And I think for our question of the day, we're going to start with a little short story and then ask the question. And the story is about my husband, who is...
But Shannon, hold on just a sec. Before you launch into the story, we're having a kind of a hard time hearing you too. You're breaking up.
Know.
So I wonder if turning off your video, even though I hate to say that, might help.
All right, is this better?
Well, yeah, go for it.
Okay. My husband served in the Marines and he has PTSD. And so around the 4th of July each year, we spend a lot of time in our basement. And I think it's hard sometimes for people to understand how much that the popping noises affect some of our service members with PTSD. And so for him, it's like an experience of gunfire. He thinks of casualties and injuries. So we spend time in the basement with our pets. And while we don't have a trained service animal for him, our companion animals give him a lot of comfort and stress relief. So our question of the day is, what programs do you all have in place to help our service members get either trained service animals or just help break down barriers to get them access to companion animals?
So yeah, question of the day. Does your organization have a veteran military program? And if so, what kind of program? Go ahead and unmute yourself or just type it in the chat. And if you don't, you're going to hear from somebody who does have one, has created one, and does a magnificent job. Julie Bang, thank you. Vet of Record webinar. Cool. Lots of people do.
That's wonderful. See a lot of discount programs and even some free adoptions. That's wonderful. So I think today, are we doing grant winners as well?
We are.
Okay.
Not sure who exactly. Is it Kelly on or Irene?
It's me today, Allison.
Hey,
hi, everyone.
Amber.
Yeah. Are we doing it now or are we waiting for national announcements? Didn't want to interrupt.
Let's do the monthly giveaway. We want to hear where all the money's going. Who are the winners?
Okay, excellent. And before I get started with the winners, I just wanted to reiterate the thank you and the celebration to all of our veterans and their families this week as we celebrate Veterans Day. And thank you to all of the organizations who do things to support those folks who support us and give up a lot for us as well. And then I also wanted to let everyone know that this past month, right, because we're doing the winners for October, it was the most organizations and the most individuals we've ever had apply for the grant. So congratulations to everyone for showing up and being a part of this great community. And without further ado, I'm going to go ahead and share my screen.
Amber, wait. I was wondering if you could just maybe explain to the new people what it is we're doing.
Oh, sure. Sorry, new people. So I did every time that you join one of these calls or watch on demand, or someone else from your team does that, you get entered in a drawing to win a grant from Maddie's fund. It's completely random, so all you have to do is watch to be entered, and then every month we pick the number of winners and then the number of grants and share it with you the following month. So after I announce the winners, I will drop the link to register in the chat. And again, sorry for not explaining that earlier. Oh, and Allison's already got it. So perfect. Thanks, Allison. All right. I will go ahead and share my screen and share the winners.
Drum roll.
All right. Can everybody see this?
Yes.
Cool. In the beginning. Perfect. All right. So we have 10 winners. Again, there were lots of folks who applied this last month. So we're really happy that we were able to go ahead and award 10 prizes.
Wow, 10.
So we've got Megan Alexander from Pitbull Rescue Central in Missouri. Come on. Oh, Jen Cody from Animal Mission in South Carolina. Jordan Craig from Spay Neuter Network. Dara Emmons from Celery Cat Cafe in Florida. Cindy Fladger from Needham Animal Shelter in Wisconsin. Renee Huddleston from Tiny Paws Kitten Rescue in Oklahoma. Kathleen Olson from Perfect Pals in Washington. Dylan Schaefer from Seattle Area Feline Rescue in Washington. Margaret Tompkins from Tompkins Foundation for FLV Advocacy, also in Missouri. And Jean Wu from 9 Lives Foundation in California. Is anyone from one of these winning organizations on the call?
Yes, I am. This is Jeannie Wu at 9
Oh,
Lives.
Jeannie, I'm sorry I got your name wrong. Congratulations.
Thank you so much. Every dollar means so much to us. Thank you.
Yeah, we're honored to support all the great work that you do and the other organizations on the call too. So congratulations, everyone. Irene or I will be following up with you after the call to get these grants sent out. Thanks so much.
Cindy and Megan are on too.
Oh, congratulations, Cindy and Megan. Hopefully I got your names pronounced correctly and your organization's names. We look forward to following up with you after the call and getting your grant sent.
Thank you so
Amber.
much. I did write in there that I was just thinking when you called my name, I never win these kinds of things because, you know, the lottery, everybody's been playing Powerball. And
Right. We'll buy a ticket for that as well. Who knows, right?
Thank you very much.
My pleasure. Congratulations, everyone.
And we are a second time winner, and it can't be more perfect timing because we're on track to serve a record-breaking number of animals this year, like many other shelters and organizations, I'm sure. Our challenge is we have about 2,000 square feet that we do our work in. So having that many animals come through in 1 year it's taken its toll on our team, but this kind of stuff just helps beyond measure. So thank you.
Completely our pleasure, Cindy. Thank you for all you do and for all your team does.
And Renee, you're welcome. So cool. I think we're ready for national updates.
Yes, if anyone has any updates, please unmute yourself and share.
In fact, I'm going to go first. Being the loudmouth I am, there's a webcast this Thursday that I really think people will enjoy. It's Allison Cardona, who's on this call, is going to tell us 3 things that we can do today to open our kennel doors and send animals home. Allison, do you want to tell us a little bit more about it? The link is, I just dropped that in the chat, but Allison, if you want to tell a little bit more.
Sure. Just very happy to be in community on this one on Thursday. Please join. There'll be lots of interaction and questions and things that you really want to hear from you as well. And even if you think that you have very barrier-free adoptions, I challenge you to come and attend the webinar. It might challenge you to think a little more.
Thank you, Allison.
And I actually, Allison, if I may, I have a separate announcement on behalf of CARE, Companions and Animals for Reform and Equity. There is a panel that's going to be on this evening at 4 p.m. Pacific, 7 p.m. Eastern. I will pop the link to register and sign up in the chat. It's on Pro Partnership, and it's on the eve of elections. We're trying to get out the vote. So feel free to join, and you can post questions in the Maddie's forum. I will also post the link in the chat. Thank you.
Thank you.
You still taking national programs?
Sure am, Bob T.
It's interesting you mentioned elections. We're kicking off here in the James City County, Williamsburg area tomorrow afternoon after the election results are pet elections. We're engaging the Board of Supervisors of the county to be campaign managers for PetSmart stuffed animals within the districts. We have a donation process that we've attached to the drive that PetSmart has with their stuffed animals for the holidays. So we're going to be assigning each board member, since they know how to run campaigns, to work their district, talk about their assigned stuffed animal, and encourage people to do not only pet food donations, but people food donations. As a holiday twist. And as a thank you for the donation, the family receives one of the stuffed animals. So, and then starting in January, we're going to use that to kick off an animal advisory council for the county, using those very same mascots that were elected to office as the conduit to have conversations about legislation, leash laws, good things that happen in the community, and things that need to be addressed and need some shoring up.
Oh man, that is such a cool idea. Thanks, Bob.
So yeah, it's a Williamsburg Donations and Volunteer Network. We have lawn signs made up. We have polling stations made up. We have the police and fire chiefs campaigning for us, and so it's going to be fun.
Hi, this is Darlene Blackman. I'm at Marin Humane in California, but my volunteer work is with the Association of Professional Humane Educators, the APHE. Some of you may have heard of it. We have a call for speakers for our 2023 conference, which is in April 19th to 21st. We had virtual conferences in 2020, 21 and 22. So we're super excited to be back in person in 2023. And if any of you are interested in learning more about it, I will put our website in the chat and also a link to learn more about submitting a proposal to speak. Thanks very much.
Thank you, Darlene. Anybody else? We've got a really great program coming up. Shannon and Ariel can tell us a little more about it. And while you're doing that, I'm going to put a post in the chat of some amazing new campaign called Pets and People Together that Maddie's Fund with Ad Council and Humane Society, this huge national campaign. And so check out some of these PSAs that they've done. It's really amazing. But take it away, Ariel and Shannon.
Okay, well, hi, everyone. Good morning and good afternoon. It is an absolute honor for me to be introducing Terry Morris. She is the executive director and founder of Vets to Vets United, which is an organization that pairs veterans with service dogs that are sourced from her local animal shelters in North Carolina, where she is located. She has an amazing story, so I don't want to spill the tea, phrases that I will never, English phrases that I always struggle with. But with that, take it away, Terry.
Thank you so much. It is really a blessing and an honor to be here today amongst so many people. All of us have that passion and that heart and desire to help our precious animals. Not only help precious animals, but also people as well, because we know When we're helping animals, we're also helping their handlers or their owners as well. And that animal human bond is so strong. I'll go ahead and get right into, let me share my screen.
Now, Terry, did you say you had a video? Was that embedded in your PowerPoint?
Yes, it is. And
So
hopefully
make sure that before you share, that the share video with sound has been, did you remember to do that?
share video with, I
So
believe,
just go ahead and stop sharing.
okay.
Yeah, folks, we didn't have a chance to practice this, but if you could stop sharing your screen and
Okay, let's see. Hold on, let me just get back up. Stop share, okay.
okay, and now share again, but before you click on share in the lower left, they'll say share sound and optimize for video clip.
In the lower left.
Yeah, you see in that where the white opens up to share.
Oh, let's see. I actually do not see that.
It's when you hit the share, there's a white window that opens up, gives you an option of which to share, correct?
Share.
And then in the lower left, it says share sound. There's a little checkbox.
Yes. And then also optimize for video clip.
Yeah, there you go. You got it. And then you
Got
can hit share. Thank you, everybody, for your patience.
Thank you. Okay. All right, so is everyone
Yep.
okay?
Looks
Okay,
great.
fantastic. Again, thank you so much for having me. We'll go ahead and get started. Oops, sorry. Okay. Oh. Button does not want to work. Okay, we'll just have to advance it this way. Okay, so first of all, I always have to give credit to the Friendly City Civitan Club. This is where we train. You really don't need a huge space to train. We train inside and outside. But we want to thank the Friendly City Civitan Club for giving us this free space so we don't have overhead costs, because it's very expensive trying to, first of all, provide service animals for free for veterans. So when you don't have that overhead cost, that is extremely important, and we're just very grateful. Okay, so I'm the founder and executive director of Vets to Vets. We pair past military service members with rescue dogs. We have a passion for helping veterans and saving dogs from euthanasia. And I'm also, you may wonder what my connection is with the military. I'm a Gold Star daughter of a proud Gold Star daughter of a B-52 bomber, Tuskegee airman. He died when I was 3 years old. He was killed during a Cuban Missile Crisis during his service. So Vets to Vets United, our identity. We're experiencing the healing power of the animal-human bond. Our vision is to improve lives, save lives, one veteran and one dog at a time. Our mission is that we pair veterans with disabilities and rescue dogs for an enhanced quality of life. And we're unique because we're rescuing dogs and we're serving veterans with veterinary services provided by our partner veterinarians. And our partner veterinarians are either offering discounted veterinary care, or we have several partners who are offering free, totally free veterinary care for the life of the animal. And that is really special because we all know how much veterinary care costs. This program is not just for the veteran, it's for the whole family. We know that when a person is suffering from post-traumatic stress, traumatic brain injury, and or physical disabilities, the family suffers as well. As a matter of fact, there's a documentary on CNN. It's called The Uncounted. And these are family members, including mothers, fathers, sisters, brothers, spouses, and children who are also committing suicide. And these people are uncounted, but they are also casualties of war. So Vets to Vets is part of the solution. So having a service dog is not going to fix everything. There are lots of different pieces of the puzzle that need to come together for veterans. Each veteran is different. They have different disabilities. However, we have found that having a service dog can actually save a life. So the veteran applies to the program. The application is reviewed, and then we match them up with a rescue dog. And then the veteran and the pup will start coming to training immediately. So right after their partner, they'll start coming to training once a week for approximately 2 years. And it is a long-term commitment, but we found that on average, now some veterans and dogs or teams will graduate prior to a 2-year deadline. Was not actually a deadline because we have some that go a little bit past 2 years. But on average, it takes about 2 years to get through a program. All the teams, of course, must pass a public access test. And I'll take you through why we take them through therapy training as well. But we take them also through therapy training. And I'll talk about that a little bit later. And also the dogs must show they can mitigate the veteran's disability. And then the graduating teams then serve as mentors for incoming teams. And we actually have some that are helping out by serving as board members now. So are we making a difference? Today, we have actually 29 veteran pup teams graduating. We just had one to graduate this past October for therapy and service. Actually, it's 30 because we have had another one to graduate as well for therapy. We have 13 teams right now in training. And I'd like to introduce you to Bill and Tank, pictured here. Bill actually surprised me with a video. He was taking a creative writing class, and he surprised me with this video, and it really just warmed my heart. See if this will play.
I'm a veteran of the Vietnam War, and my name is Bill. And a service dog saved my life. I'd like to introduce you to my tank. No, not that kind of tank. No, not that kind of service. He's not the Army. This is my tank. Yes, he is my service dog, but he's so much more than that. We are a team. He looks after me, and that's a hard job. And I look after him, that's a fun job. He's my physical and emotional support dog. Tank gives me total, unquestioned loyalty and love. He's like my shadow. You see me, you see Tank, and we are together doing our thing. When I go to bed, he is there in his bed right beside my bed. I wake up in the morning, he is there to lick my hand, good morning, and to help me get up when needed. We have our own special way to communicate with each other.
Be happy.
That nub of tail of his goes like a machine gun when he sees anyone, especially children. As a therapy dog, we go into assisted living centers, schools, and hospitals. Tank it enjoys it as much as the patients, especially if they give him a cup of ice cream. When he's not working, he loves his football. Playing with his mom and I and another scoop of vanilla ice cream also makes this day. Tank loves me, takes good care of me, loves his family, and that toothless smile of his always gathers a crowd of admirers. They call him cute, adorable, sweet, handsome, and smart. But I know they're really describing me. Tank has positively affected my families and my life. Love you, Tank, my friend and support. Like most people, I didn't know what depression or PTSD was, but I did know life was not right. I had a problem. Irritability, physical pain, crying for no reason but the hurt, feeling down and angry, lonely, even with a loving family. It became unbearable. I could see only one way out of the pain. But that is not the answer. I finally got the nerve to reach out for help. Medication and counseling helped, and then I met my tank. For me and my family, he is a life-changing event. A service dog saved my life. Will the service dog do the same for you? I don't know. Maybe you should check it out.
Wow, that was great.
Thank you.
So wonderful.
I'm a
See, thank you so much. Yes, I actually it was a total surprise for me. And it was just amazing. It's amazing how having a service dog can bring out some of the beautiful qualities that these veterans have. And so thank you very much. Okay. All right, the power of the animal human bond, emotional and physical health benefits. Let's just talk about those really quickly. But first of all, we'd like to talk about, people always ask me, what's the difference between a service dog, a therapy dog, and an emotional support animal? They're all three different types of working dogs, but there is a difference. So let's go through that real quick. Service dogs, they should enhance the partner's life, assist them to be more independent. There are various types of service dogs, especially that are specifically trained to perform a task to help mitigate and handle his disability. And we know there are a ton of different tasks that these animals can perform in different types of service dogs. Service dogs and their handlers have public access rights defined by the ADA. And service animals are dogs and miniature horses only. Therapy animals, they're also a type of working animal, but they're not a type of service animal. They may include other animals, other species of animals, but are typically dogs and cats, and they've been specifically trained to provide emotional assistance to people in hospitals, nursing homes, and other institutions. They do not have the same public access rights as service animals, and they're not covered under the ADA. What about emotional support and companion animals? And as we heard previously, emotional support animals can actually save lives themselves. Save a life as well. They provide support, well-being, comfort, aid to an individual through companionship. They can include other species of animals. It doesn't need any specific training. However, they go through our program. We do make sure they have the basic obedience skills, and they do not have public access rights. These are some of the different types of services, and I have 2 slides of services just so you can see some of the things that we train. This is by no means all of the skills that we can teach these animals to do, but turning on and off lights, waking a handler from a nightmare, reminding the handler to take their medication, pushing a button to call 911 for help, go get help if someone's in trouble, reduce hypervigilance in public places, creating a buffer zone between the handler and others. Retrieving dropped items like crutches, keys, cane, etc. Retrieving an emergency kit. Balance and stability. Assisting with removal of clothing, opening and closing doors, pushing a handicap button or the elevator button so that the door opens, searching a home. So these are just a few things that we're able to train these dogs to do in our program. So these are some ways that dogs can help turn your life around. Getting more active. Dogs help you to get out of the house, to get active, meet new people. So socialization, that's extremely important, especially for veterans, because we find that a lot of times they will isolate in the home, sometimes for years, and never come out. So this is extremely important, and it's not good emotionally to isolate yourself or be isolated all the time. Give more love. Dogs bring out the feelings of affection, and they love unconditionally. Feeling protected. Dogs make you feel safe. Also nightmares, traumatic flashbacks, anxiety, and depression can make you feel vulnerable. Mitigate hypervigilance. Dogs are a natural alert mechanism. Boosting the immunity. They found that people have higher levels of some immune system chemicals. They have a stronger immune system activation. Social interaction, we talked about it again. They're natural conversation starters. So even if you're not very apt to talk to strangers. A lot of times you actually make, and we have seen some of our veterans make lifelong friends, new friends, people they never met before, just by training out in public places. And they run into someone, and the conversation starts about their dog, and it ends up being a lifelong friendship. Elderly, we know that elderly people have a longer lifespan when they have animals. Also, Alzheimer's patients, we know that caregivers actually find it much easier to take care of Alzheimer's patients if there's an animal present. A healthier heart, lower stress hormones, cortisol, and norepinephrine. There is a link between chemicals and plaque buildup in the arteries and heart disease. You find that you have lower triglycerides and cholesterol. Reduce stress, increase levels of the feel-good hormones like oxytocin, prolactin, dopamine, serotonin. Healthy outcomes. We have found in our program, some of our veterans actually, we find that there's reduced in the number of medical visits. We found that there's a reduction in the amount of medication as well that some of the veterans are taking. This, of course, affects costs, decrease the amount of cost for healthcare, reduce the rate of violence and suicide by reducing stress and providing unconditional love and companionship. Prevent health conditions such as diabetes, obesity, and arthritis, because now you're getting out more, you're exercising, and you're doing this because you know your dog needs this in order to be emotionally stable. And you want to take care of your dog. You have this strong bond with your dog, and so you want to get out and do these things. Lessen the chance of cardiovascular disease. We talked about that. And of course, we want to reduce the number of animals that are euthanized at our shelter. The reason why we use rescue animals is because 10 years ago, when I first started this program, North Carolina was number one. We euthanized more animals at our shelter than any other state. That is why I chose to use rescue animals, because I couldn't imagine, and it's just simply due to overpopulation, and these animals make beautiful service animals. Of course, all programs screen animals, so we must do our screening. But these animals make wonderful, beautiful service animals. And we know that the veteran population as well, the suicide rate in the veteran population, at the time when I started the program, it was 22 per day. Now I think the most recent data says 17, but that's still just unacceptable. And if we can save animals and save veterans by just partnering them together and giving them a purpose in life, that's just a beautiful thing. Okay, so some people ask, how can a shelter and a service dog training organization form a partnership? So we have partnerships with several of our local shelters around. And the first thing to do is just shelters can contact service dog training organizations. This can be locally, it can be inside the US, or it could be outside the US. I just recently got a call from a young lady who has a rescue. She's local here, but she rescues from Mexico. So there are dogs there that also need homes. And so we're talking about potentially partnering with their organization as well. Dog screening and temperament testing. Of course, we know this is so important. We can't save all of the dogs. They must be temperament tested, and there are just some things that we just cannot, we can't help with. We want to improve the quality of life for the veteran. And so there's if a dog has severe issues or emotional issues that we know we cannot handle, then of course we won't be able to use those animals. We're actually looking for the easiest dogs possible. And there's so many of them here in North Carolina and beyond. Trust and accountability. This is something that is so important in developing a relationship with a rescue or a shelter. And that is because they want to make sure once they give you that animal, they can trust you with the animal, that you're gonna be accountable, and you need to be accountable. What is the plan? What's gonna happen if the partnership doesn't work out? What are you gonna do with the animal? Are you partnering with a shelter or rescue that will allow you to give the animal back if it's not working out and you don't have space for it? Or is the rescue or the shelter saying, no, once the adoption is finalized, that's it. You have the dog for forever. It's your responsibility. You have to think about all of those things as well. Developing this is something that a veteran has done here in North Carolina, and the program, it took a few years to catch on, but it's working wonderfully. Partner up with your shelters to develop a veteran dog walk program. So even if the person, it might be a homeless veteran who doesn't really have housing, but you can't place an animal with anyone who doesn't have a home. However, they can actually come in. They can receive the benefits by coming into a shelter and walking these animals whenever they like. Or if you have a set date or time when your shelter is open, invite veterans from different veteran service organizations, or there are different housing authorities that house veterans specifically. Talk to the executive directors and see if you can share your shelter with these veterans. Adopting a program on a national scale. Someone is asking, how do you do that? That's a good question. And we actually have not done that. We have many people who are calling us from all over the United States, who are asking, say, we don't have a program here in our area. Do you have a branch here? And we do not. Our headquarters is in Durham, North Carolina, and all of the veterans must be able to come here to come to training. That's one of our limitations, and it really breaks my heart when there's a veteran who really needs this service, but they're unable to travel to Durham in order to receive the services. And so our big dream is that we can develop a state-of-the-art training facility right here in Durham that has housing, so that the veteran can come here, stay for a while, maybe a month or 2 months, receive some intense training, and then if they go back home, work it, and then come back until they're able to meet all of the minimum standards that are required to be a service dog team. So that is our big dream, our big goal. One thing that I really feel is very important is that if you do have a branch in another county or another state for your organization, that you really think it out very thoroughly, because the headquarters, you are going to be accountable and responsible for anything that happens in another branch in another county or another state. It's all going to come back to the headquarters or whoever the executive director is for those branches. Make sure you can partner up with VA facilities, mental health care, especially VA facilities. They have actually a social work program or housing program also. Partner up with shelters. Do you think about if you have a program in another location, do you have a training facility in that location? Do you have enough volunteers? Do you have enough employees, staff to be able to handle or manage a different branch in a different county or state? What about fosters? Do you have fosters lined up? You remember, you're going to be accountable financially as well. So you're accountable financially. You are accountable for the veterans that you enroll into the program and the dogs. So that's a lot. Believe me, it's really difficult to manage all of that, even in one location. It can be done. There are several organizations that do have their services in different states, which is a wonderful thing. What about universities? Partnering up with universities. One of the things that I found is really important is that you're able to collect data on what your successes are. We have a functional metric survey that we send out. However, we would love to have more data. And you can actually partner up with universities. There's some departments that have students that may be in the Department of Statistics that may be able to develop a project to partner up with you and get more data. Very, very, very important for grant writing. We're right now partnered up with the University of Tennessee, Line Care. See the website to learn more information. Dr. Blackwell.
Terry, I'm sorry to interrupt. Terry, we're losing your audio.
Oh, I'm sorry. Okay,
Just speak up a little. Thank you.
Is that better? Is that better? Okay, are you able to hear me better now? Okay. Can you hear me okay?
It's better now, Terry.
Yes,
Okay.
better. Sorry. I was,
Yes, we can hear you.
Okay. Okay, thank you. So we partnered up with the University of Tennessee at Line Care. Dr. Michael Blackwell, has developed a program for pet health equity. We have a pilot program going on right now, specifically to target veterans. We want veterinary care to be accessible for low income. So our pilot program is here for veterans. However, this program actually is all over the country. As a matter of fact, it's nationwide. And they want veterinary care or health care equity for all low income individuals. So they have to meet certain guidelines. Please check out this program if you're interested in that. Also, UNC Chapel Hill, I mentioned the problem of us not having housing for veterans who live too far away, or they might actually live very close, but due to their disability, they're not able to drive. So they're not able to come to training. And again, I told you that just breaks my heart because those are the main people that really need service dogs, especially if they're alone. However, the Center for Excellence in Community and Mental Health has partnered with us and they're developing tiny houses for a community for people suffering from mental health issues. And they have allocated 5 of those tiny houses for us to be able to use to house veterans. So they can be very close, and we just have to arrange transportation from Chapel Hill to Durham, which is right down the street. So those are some other things you can think about as far as forming partnerships. Okay, and that is it. So finally, I'd like to say I dedicated this program again to my father, who was killed during the Cuban Missile Crisis when I was 3. He was a Tuskegee pilot, B-52 bomber pilot, and also to my sister. My sister followed in my dad. She was 5 when he was killed. She followed in my dad's footsteps, and she is also a Tuskegee pilot. As a matter of fact, she's the first female to graduate from the Air Force ROTC pilot training program at Tuskegee. So I'm very proud of my dad and my sister. And that is it for today. And I'm very, very happy to take any questions that any of you might have. Thank you very much for having me.
just amazing, really, truly inspiring, Terry. As somebody said here, Norma Wallace, your father is so proud of you and your sister. Oh my goodness.
Thank you.
I forget Ariel or Shannon, who was going to take the questions? Because there are a few in the chat.
Yeah, so Terry, if you want to unshare your screen so that we can all see each other, we would love, I saw a bunch of questions in the chat, and if people want to unmute and ask Terry, this would be a great time for that.
I think we have Erin with a hand raised as well.
Yes, hello. I'm sorry. I apologize today. I'm having to listen while I'm in my car driving.
Oh, it's okay. How are you?
I'm fine. I love your discussion. And one question that I had, we are actually with a service dog program located in Georgia. And I was wondering how to get in contact with your organization to possibly follow up with some more questions. Because again, unfortunately, I'm driving. But
Sure. If you'd like to, I can put my email address in chat. Well, I'm not sure if you'll be able to.
I will screenshot it.
Okay.
We
So,
will
and
be
I would
posting
love to
this to our Maddie's Pet Forum page afterwards. So the recording and anything in the chat will be there too. So don't get in an accident on our.
Yeah, please be safe.
Thanks, Erin, for your question. There was a question, Terry, around if people are allowed to have their own dogs trained, or if they typically come from the shelter.
If people are allowed to have their own dogs trained, okay, the law here in North Carolina states that you can train your own service dog, and it may vary by state, but you can train your own service dog. But if you would like to enroll into our program, then we will help you. We'll teach you how to train. So they are training their own service dog. but they're going through a program, our program, in order to, so we teach them how to train their own dog. But yes, in North Carolina, you can train your own service dog. You don't have to go through any specific type of program in order to train your service dog. And I did want to say one thing about the temperament testing and shelters. It takes a lot of time and effort to find the appropriate dog. So one of the things I've done is I have actually sent shelters a video of a temperament test that is very similar to the ones the one that we use. And it is so helpful if whoever is in charge of intake or temperament testing of animals at that shelter, or screening animals, or evaluating them behaviorally, if they could take a look at that, it saves so much time as far as screening animals. When I first started the program, I could stay at the shelter most of the day just screening animals, trying to find one that potentially could make it through the service dog training program. And just because they pass the temperament test, it doesn't mean that they can make it through. There are lots of different things that may arise during your training. It may not show up for 8-9 months later. So just because it passed the temperament test, it doesn't mean, it just increases the likelihood that they would make it through the program. And it also weeds out things that you cannot handle.
Terry, I think we're having a little bit of a hard time hearing you again, but if we can, yeah, thank you. I think I understood the answers, but I want to make sure that people can continue to hear you. Someone did ask what do you look for in a shelter dog, and where they would be able to find that test video.
I actually can send it to you. If you'd like, I'll be happy to send it to you. My email address is in the chat, so I'll be happy to share it with anyone who would like to have that video. And what we look for there's lots of things we look for. I can probably tell you some of the things we just cannot handle, and that is if they have a severe resource guarding issue, if they have a bite history, if they have a fear of children, or elderly people, men, those type of things, we definitely cannot. Now, those animals can be helped, of course, but it may take a lot of time to rehabilitate those animals. So those are some of the things. We're looking, again, for the easiest dogs possible. So there's several different exercises we go through on that temperament test. Are they able to recover if you drop a loud object? Or do they go under a chair and never recover? So the dog that goes under the chair, of course, would be one that we wouldn't be able to use. But a dog that's like, oh my God, that scared me, but what was that? They can recover, then those type of things are the things that we're looking for. And again, there's several different things on the temperament test that we look for. We also look for health as well. So we can't, we had someone that wanted us to adopt a dog that was disabled. Well, we can't do that. You can't teach a disabled dog how to help a disabled person, because the work is hard. It's hard on the dog, so the dogs must be healthy. That we choose for taking through the program.
Amazing. Well, thank you so much, Dr. Morris. We will continue this conversation over at Maddie's Pet Forum, where we will post the resources, and any further questions can be asked to Dr. Morris. I know that Allison, you want to share that video, so we will close out with that video. Thank you, everyone.
Okay, hold on a second. Let me just get it set up.
Thank you, everybody. Thank you.
Thank you, Dr. Terry. Wonderful. Hold on a sec, folks. You're going to love this. This is a new PSA. Let me make sure I share the sound, optimize. And thank you to the Ad Council. Let's see, can you see?
So much. Fostering a pet for a friend or neighbor can keep families together. Learn more at petsandpeopletogether.org. Thank you so much. Fostering a pet for a friend or neighbor can keep families together. Learn more at petsandpeopletogether.org.
I had to play it twice. I don't know that it was shared properly. Anyway, thank you all so much for joining us. Thank you, Ariel, Shannon. Fabulous to have you as our co-hosts. And we will be in touch, Dr. Morris. Everybody have a great day and a great weekend and thoughtful Veterans Day.
Thank you.
Thank you.
Thank you for your sacrifice and service for all veterans who are on today. Thank you so much.